All right, what's going on, guys? It is time for another scrolling through my IG now. This was voted on by my members. I gave them a couple of options, and this was the video they requested. If you don't know, if you haven't seen, I do have a pretty extensive members area. You get early releases to videos. You get members-only videos that don't have any ads, Q&As, form checks, deep dives into this ECM stuff, extended scrolling through IGs, which is ridiculous, over-the-top humor stuff I can't put on the main channel. So a little bit of something for everybody, so check that out if you're interested. If not, just subscribe, guys. I'm trying to get a sponsor for my videos so I can take ads off this shit, so more subscribers will help. I've got really good watch time and everything else. I just need a little bit more subs, so please subscribe if you are not. All right, so first off, we're going to take a look at Mr. Paul Carter, who... what the fuck is going on here, right? I think this guy's kind of going down the Dr. Mike route. So I guess he did a, what is this? A CO2 ablative laser, which is kind of funny because that's kind of like what the old ladies that I train do, the 50, 60-year-old women. If you were around me, I'm sure I could get you a good referral, Paul. But I don't really know what the goal is here. I mean, what the fuck? Look like a fucking mutant. Like, why do people do this stupid shit to their body? Like, they have this crazy insecurities and then they post themselves. Like, this is very Dr. Mike-ish. It's not quite as bad as, like, bleeding out your ass like he was doing, but this is kind of ridiculous. And, I mean, I feel like Paul is just trying his hardest to become a fuckboy in his, like, mid-50s or however old he is. I don't know why. Because it's like, come on, I mean, I was a fuckboy. This is my peak fuckboy stage here. Competing in physique. I've got the faux hawk. I've got the bougie, expensive V-neck, the selfie, almost doing the kissy lips. So being a fuckboy is something that we tend to grow out of, not something that we try to become as we are way past middle age. So I don't really know what he's trying to do here. And it's not like you got the jawline anyway for it. No matter how hard you try to make up for it and make it look like you do by grooming your beard. And it's funny, this is his Facebook profile picture. And, you know, he can tell he's trying really hard to pull off the fuckboy look here. He's kind of got the little squint. You know, he looks pretty lean here. This looks like it could have been after, I don't know, like some big fast and colonoscopy or some shit because he's old as shit, right? So this is probably the closest to fuckboy he'll ever look. It's like just the right lighting, like it made his eyes look lighter than they are. But you can't be a fuckboy if you're bald either. But I feel like this version of Paul would want to kick this version's ass. Like, for sure. Like, how do we go from this to ablative laser surgery to improve collagen synthesis to make your skin look pretty? I mean, what the fuck happened to you, Paul? So yeah, and these were some of the comments on this thread that this was from. This is on Reddit. I'm obviously blocked by Paul like more than half the industry, so I don't get any of these posts, but someone posted this under the More Plays, More Dates subreddit, and these were some of the responses, which are great. Bautista, Gay Batista, looks like Dave Batista if he has Down syndrome. Holy shit, this guy's the biggest a-hole in the fitness industry. And it's kind of wild to me that this dude has any followers at all. I feel like he's a case of somebody who's just been around for a long time. Like, if he tried to establish a presence now, in this day and age, no one would pay attention to him. He's got no fucking original thought at all. And he's just a fucking dick. This was a video that Natural Hypertrophy made, why everyone hates Paul Carter. And then here's another thread from Reddit. Why does everyone here dislike Paul Carter? If we look at some of the reasons, people talk about how he's completely changed all of his opinions in training, which is kind of interesting because he seems very dogmatic. You think someone who has changed their mind a bunch of times wouldn't be so, it's got to be this way and only this way. He relies on studies too much. He uses them as if it's concrete proof he's right, which that's what I'm about to bring up. He's a bully online, but also embarrassingly, emotionally, and mentally weak. Yeah, that's when you block everybody who has anything to say that isn't in complete agreement with you. Yeah, you are emotionally and mentally weak. And this guy goes on to say, you are overlooking his character. People dislike him because he's a bully and often wrong about things and overly dogmatic, and he's just an asshole. Like, listen to this. This is ridiculous. I read one of his books that I regretfully purchased. I didn't understand one of his concepts and asked him a question. He called me stupid and said I need to learn reading comprehension. He didn't even try to explain. Now that made me stupid for buying his book and angry for the way he answered. That's fucking ridiculous. Like, what kind of a dickhead like talks like this to his supporters? Like, I don't understand how someone like John Meadows like was tight with him back in the day. Like, John Meadows was such a cool, nice guy. I don't see how anyone with good character would associate with this fucking douchebag. Here's another one. I attempted to discuss with him how he might not be correct, including photos of myself and clients doing something that he said was impossible. He backtracked his statement, called me a pussy, said he fucked his wife, then blocked me. Like, what the fuck? And then I really like this one a lot. Paul's problem is he actually doesn't understand this stuff as well as he claims, and he makes big absolute statements about things that are not backed by science. Yeah, I don't think Paul understands fucking anything about the way the body works. You watch him work out, like, you can tell he's pretty fucking clueless. But the topic that I'm referring to, and what is the thing that everybody sent me to get my opinion on, was this. And like I said, I'm blocked, so I can't access his post. So someone sent me this little shitty screenshot, but I'll read it. So this is in reference to this study where they showed that there wasn't a significant difference among the participants with lat recruitment, whether they lean back or whether they were vertical.
Okay, so I guess I really don't even know like what he's referring to when he's talking about this shit. But in general, I know that he's really against the thought that having an extended spine could be bad in some circumstances, or at least not optimal. He's probably heard me or other people say that if you're really arching your back, you're not going to get as much tension on your pecs, but also your lats on certain pulling movements. So I think that's why he's bringing this up. But it's like, you don't even need to look at things through like an ECM lens to understand that if you pull from a more neutral spine position, you'll feel more lats. I mean, you don't need to look at it the way I look at it. Like if I'm able to keep posterior expansion and maintain a more neutral spine, that's more of like a mid propulsion bias, more of like a yielding bias there, where if I'm arching my back and I'm pulling from there, that's what I would think of as more of a late propulsive, like concentric bias. You don't even think about that. Just think about like if I'm extended and I'm pulling from there, you automatically are like taking away the room for your scapula to glide upwardly. You're taking away excursion capabilities. Like, you're limiting the excursion of your scapula. And anytime you do that, you're going to lose length and tension on your lats, besides maybe like the lower fiber. So if I'm like retract, if I'm arched and I'm pulling, it pretty much just becomes like an adduction and like shoulder extension movement. When you lose a lot of that scapular motion, you're losing a lot of length and you're losing a lot of the function that the lats do, because it has a line of pull on the inferior border of the scapula. So you don't necessarily want to keep it stuck in place all the time.
And so what he said in his post is this EMG study showed no difference in lat activation whether they stayed upright with a stacked rib cage or they leaned back to 30 degrees inclination and had spine extension. The lat activation was the same. Leaning back this much does not make this more upper back dominant, and spine extension does not make it less lats. Stop making dumb takes go viral. And so if we look at his little picture here, he says there was no difference in lat activation whether you lean back this much or stay upright. And rib compression is not a thing. That's literally why they make this $500 model, to show how compression changes the shape. Everything compresses, bro. So let's think about what he actually said, though. So he said that when you are staying upright with a stacked rib cage or leaning back with spine extension, the activation is the same. Like, this fucking guy, like, you're a fucking idiot, Paul. Open your goddamn eyes. Look at this. You look at the guy who's upright. Look at that extension. Does that look stacked at all? That doesn't look stacked in the least bit. Look at the guy leaning back. That's a lot more stacked rib cage. So it's exact opposite of what the fuck you're saying, you idiot. You know, the more vertical you are, usually the more extended you are. You know, we kind of have to do that as we go into more shoulder flexion. Less shoulder flexion, you're not going to be as arched. You're a little bit more neutral. And what's funny is at that angle, with a more neutral spine, they got the same kind of lat activation as they did going vertical with more of an arched spine. So that kind of proves my fucking point. You really shouldn't get as much lat activation if you were neutral in the upright and neutral in the back. But if you're super extended pulling down and you're a little more neutral pulling back from a little bit of an incline, I can see why that would be similar lat recruitment. So like, what an idiot. Like the study said nothing about stacked rib cage, about compression. It didn't talk about neutral spines at all. All it said was 30 degrees of a torso lean back and an upright torso. It didn't fucking care what you did to get there. So it's like, I don't know why Paul is so hung up on this rib compression thing. It could be because like I use him as the example for really shitty mechanics and horrible rib compression, and maybe he's on this mission to make it seem like it doesn't mean anything, but he's an idiot. Like, again, if you're going to follow Paul, you might as well just use ChatGPT. He's got no insights whatsoever, and the very few insights he does have are wrong. And in case you forgot, he lifts like a jackass. Look at this. Butt's coming off, huge arch, chin tucked, shoulders elevated. This is the ugliest press I've ever seen. I would probably even say Mr. Mike might have a better form on pressing than this. You know, I did a kind of a deeper dive in a different scrolling through IG. Check that out if you want to see a little bit more hate on Paul. But in there, I kind of critique his form and his physique a lot more. But I just had to respond to this because I got this sent to me from like 6 or 7 different people. And it's just ridiculous. He's literally pulling things and saying things that they didn't say at all in the study. They didn't say neutral spine. They didn't say anything about spine position at all. And if you look at the picture that he posted, it's the opposite of what he says. The fuck? So not only is he an asshole, he's also an idiot. So why the fuck do people listen to him? I mean, what does it mean that in this industry that is full of unlikable douchebags that you are the one that everyone universally dislikes the most? Kind of speaks volumes about you. All right, so let's just keep this going with the absolute worst of the fitness industry. So I definitely have Paul and Mike in my Mount Rushmore of horrible fitness influencers.
Honestly, I'm kind of curious about your guys' take. Who do you think is the worst fitness influencer between Mike and Paul? Drop them in the comments. Help with the algo.
And as you know, I've critiqued Dr. Mike's form a ton. And, you know, he's known for having a big protruding power gut. And the way he works out is the cause of that. And I'm going to kind of break it down why that is and how it would be a little different if you were a different structure than him. You might not have as much of a power gut. You might have more of like a lower belly pooch. So let's check this out. This is actually functional patterns breaking down his belly pooch a little bit.
Do you have hypothetical, probable plans for a very ambitious surgery? No matter what body fat I have a big gut, just plain old. And it's really just the genetic laxity of the abdominal wall. It has nothing to do with muscle.
Such a big cope. Like, Jesus Christ. Like, his brain won't even let him, like, register that he could be wrong and doing shit incorrectly.
Strength and all that shit. And so you can placate the obliques, you can placate the rectus abdominis, and it brings your waist in. Just in case you were ever going to blow that out, you get a polymer sheath installed around your entire, like a corset.
I don't know who this guy is, but this guy looks like he's trying hard to, like, not just lose his shit and be like, what the fuck is wrong with you, man? Maybe this is where Paul is headed. If he can't get the fuckboy look that he's going for, maybe he'll get more extreme.
And then it constantly keeps your waist to the size that most people of my leanness have. I have been thinking about potentially going to that max level of surgery and getting my 2 bottom ribs broken inwards to have an even cooler, even smaller.
Just like nodding his head like, what a fucking psycho. Like, that's mental illness. Like, for real, Dr. Mike is mentally ill. It's like Kanye. I know I've said that before, but like, it really is. People need to stop giving him a platform.
Waist, ideally, I'd like to have a tiny waist. I think it's magical.
And these functional patterns guys, they don't get everything right, but this is one thing they are right. I mean, it's not a hernia, as he's calling it. But yeah, the way he's doing this is the reason he's got that power gut.
And I'm talking about the excessive anterior tilt, the global spinal extension, the lack of internal rotation at all, the femur's ERing. All that is going to make your, well, if you're like a wider ISA, what that's going to do is going to get you even more posteriorly compressed. So if you're like Mike or someone with his structure, it's like we're already kind of getting posteriorly compressed, and doing that just closes this part down even more, right? And what does that do? That gives you less space here to expand again. So you can see that is going to potentially give you more of that power gut, more of that pregnant belly. And then you have your pelvis, your anteriorly tipping. Okay, so now we've got your pelvis anteriorly tipping on top of a rib cage that's trying to pull up and getting pushed from the back, and you can see how that would just present a big, huge belly.
And someone else who has been really squatting just like this, who also has a bit of a power gut, is good old Nick Walker. I don't see too big of a difference at all in their technique. I also don't see too big a difference at all in their fucking huge guts. So, I mean, really, Nick has ruined his physique ever since he started doing this RP bullshit. And it's like I said, on this channel, I've said it on his page many times, it's going to make his waist wider. And his waist got even fucking more out of control this year. I mean, that's from the back. I mean, that's a shot of the front when doing a back double, but that's crazy. I could not make my stomach look like that in fucking 100 years if I tried my hardest. And, I mean, this is just crazy looking. You can see, like, how much that sticks out past his chest. Like, I don't want my stomach sticking out past my pecs. I want that to kind of taper down. So let's talk about what a belly pooch is and why it happens and how there's different presentations based off of your ISA. So this is a great diagram I got from Zach Couples when I went and took his seminar this weekend. This is how a wide ISA's diaphragm and compression strategies kind of bias them to have a higher resting power gut. So just in general, a wider ISA is going to have a little bit higher sitting viscera, like all their guts are going to sit up a little bit higher. And that's just because of the structure. That's just because they've got more volume. So as they inhale, their diaphragm descends less than a narrow ISA who's got less volume. As they inhale, their contraction of the diaphragm takes them to lower, and that's going to push the viscera down lower. And that's just based off of their structure and where everything attaches to the ribs and the way that they compress sequentially differently. All right, so this is the belly pooch demonstration using the syringes. So this is my competition syringe, 5 milliliters. This is my off-season syringe, 3 milliliters. Just joking. Never taken that much except for when I was taking Primo and Prope. That was like 3 milliliters a shot. That was a bitch. But here we have a wide ISA and a narrow ISA. Same exact height. The tube length is the same. One is just wider in diameter. So we can think of the black part of the plunger as the diaphragm and the stick and everything below it as the viscera, as the guts. So this is a really good way you can illustrate the difference in volume management. So let's say we were to breathe in 2 milliliters of air. So we're inhaling, the diaphragm is descending as we inhale. That is the contraction. And so we have 2 milliliters from the wide ISA and 2 milliliters from the narrow ISA. So it's the same exact amount of air and fluid pressure, but we have these viscera on the narrow ISA much more descended just because you don't have as wide as a tube. So you've got nowhere to go but down, but lower. So that's just an example of why the guts and the viscera sit lower on the narrow ISA versus the wide ISA, why they have the lower belly pooch, and why they have the higher power gut. And credit to Zach Couples for showing me this. It was actually a really good illustration. So what happens with the wide ISA is they've got a little more posterior compression bias than a narrow ISA. That posterior compression is going to take away space for the viscera to sit back. So it's going to rest more forward than on a narrow. If we look at a narrow, they are more posteriorly expanded, but more compressed anteriorly. So the viscera is going to sit a little bit posteriorly compared to the wider ISA. And so you can see the diaphragm shape is kind of flipped between these two because of the opposite areas of compression. And so the wider ISA, when they get super compressed, they're going to walk around with that power gut. As they get anteriorly tilted and get more posterior compression, their belly starts to like really sit up high and bulge out. It's the pregnant powerlifter look. A narrow ISA, they kind of get pulled down. The abs get really shortened from both sides, and the viscera gets pushed down into the back and lower, so it kind of like spills out from like the lower belly pooch. It kind of looks like a beer belly, and this can happen with really like lean and or even skinny people. I see it pretty often. Like someone's just like, why do I have this belly pooch? I'm not like that fat, but it's because they're compressed and their structure is making it so that the viscera is sitting lower. They're not taking good breaths in. They're not able to get good inhalations and exhalations in, so their guts don't move. They just sit in that posterior lower cavity, which makes it kind of spill out from under, where the wider ones are up higher. So if you notice that your belly just seems to be like sticking out more than it should based off your body fat level, then you need to work on kind of getting your pelvis back into a neutral position and restoring the shape of your thorax. And that's going to be a little different approach depending on if you're a wider ISA or a narrow ISA. You can also see, looking at this picture, how like the abs are lengthened on the wide ISA and how they're shortened on the narrow. So this is a great picture. I actually really love it. The seminar I did was pretty cool. It was like review for me mainly. I mean, I didn't really learn any new concepts, but I got to really fine tune and get to the nuances on some things. So it was really worth it for me. If you have no experience in any of this kind of stuff at all, it's a pretty good seminar to take. He didn't dive into any asymmetry, but that's just because it took 2 full days just to go over more of the basic stuff. And this is a picture of us all, and I'm just showing you this because this is probably like the best mog job I've ever done. I'm mogging out everybody in this. I mean, check it out. I look like I'm like photoshopped in here all shittily. And like when we took it, I was like, I'm about to fucking mog these fools. I knew I was at a good angle. I kind of turned a little bit. So that's hilarious. Maybe like this might be better than when I met Big Rami. I tried my best to mog on Big Rami, and I don't think you can tell that he's 120 pounds bigger than me here. I think it's a skill I definitely have acquired over the years. But in general, for both presentations, if you want to get rid of your belly pooch, keep your stack, keep your contact points, don't do excessive range of motion, manage your pressure, make sure you're breathing right. Like all that will be the same for both presentations. All right, up next, we're gonna talk a little bit about Pectus Excavatum. Now I have a video that's coming out on this. It's gonna be a deep dive, so I'm just gonna touch on a couple things in this. So this is a post from Conor Harris. And he says the goal is to get the sternum area to expand, move out, in particular, drive those lowest bucket handles downward. That's both correct, but I would, even before I would put either of those, I would say you need posterior expansion, because that's like the biggest issue that you've got to reverse engineer first if you've got pectus, because pectus is always, it's like always a narrow ISA. You're not gonna be a wide ISA and get true pectus. I mean, you can get so ADP compressed, it can start to like look weird, but it's not gonna be the same as a narrow, they can actually get like a deep cavernous hole. But yeah, they need to get posterior expansion, because that's kind of the last thing that happened, and that's what's kind of really closing them down. They close down anteriorly first, and then when they lose posterior expansion, now they're no longer able to get the air to like create a vortex and expand things. It's getting pushed through the belly. These people usually have a belly pooch, like we were just talking about, and it starts to like cave in the sternum. It creates like a cycle, because the diaphragm doesn't dome, it stays down a little flat, and so every time you exhale and you're not able to get it up, you kind of reinforce that sucking inward of the chest wall. So these are both important goals, but first, you gotta get posterior and lateral rib expansion. So let's look at what Conor is suggesting. And I'm a fan of Conor. I'm gonna try to have him on the podcast later this year. We were talking a little bit, which would be really cool, because he's by far the biggest name that does any of this type of stuff. And we do have a little bit of different lens at looking through stuff, but I think he's great at what he does. But I do think I might do things slightly differently when dealing with pectus. So he says this is the first move he would do, a 90-90 supine chest opener. So I kind of can see why he's doing this. He's got the neck support. He's got the hands rested. This is very chill, which you need if you have pectus. He's probably trying to get the anterior muscles to kind of inhibit a little bit. My problem is, like, I don't think you need to worry about inhibiting these muscles yet. Like, get some posterior expansion, restore a little bit of shape to the thorax, and you might not even need to inhibit things. I kind of get the reasoning why he would do this, but I would do a 90-90, but I wouldn't be reaching backwards, just because like you're rotating back. That's external rotation, that's compression posteriorly. Like, that's really where we want to open up things, especially as dorsal rosterly, like between your shoulder blades. And whenever you do that, you kind of like pin your scapula back and you close that space down. So probably not my first choice, although I do kind of understand his reasoning. But if I were to inhibit, I would probably do it at the end after I did all the breathing stuff, because you might not need to then. So the second move he says he would do would be a med ball chest opener. So this one, I definitely don't think it would be the second move I would do. It could be something you would do. It could be really beneficial, but probably down the line. And this is kind of another like pec inhibition move that we do in PRI. But the problem is when you have pectus, like this will still actually, it'll make you collapse in. It'll be like a fake expansion. You just got so much posterior compression. Oh, I don't think he does the arms out actually, which makes this a lot better, but I still don't think I would do that right away, because it's like a fake expansion. You're just pushing your sternum forward. We're not actually getting posterior expansion first, so we can't get a true lift. You're just orienting it up. But I think he keeps his hands by his side, which actually makes this a lot better, but it's still not what I would do. And then for number 3, he has a short-seated banded pull-apart, which this is probably the one thing I'm going to have to disagree kind of hard on. This is probably, like, in my opinion, not a very good move to do for pectus people, especially early on at all, especially like the third thing they do. So in general, pectus is going to be narrows, like I was saying. So short-seated isn't usually the best position for narrows. It's kind of more of a wider thing. Narrows tend to be pretty posteriorly compressed, and they can roll under pretty good. They can like create a little extra compression doing that, where a wide this would be kind of beneficial for. But where retracting and pulling apart, that's a lot of posterior compression. We've done nothing to expand that yet, really. So I think this move would actually create potentially some issues if you hadn't properly posteriorly expanded first and done a few other things, actually. So in general, I'm usually on board with Conor with most of his stuff, but this is one of the rare times where I probably would take a little bit different approach. Also, just randomly, have you guys noticed Conor's fucking juiced up as shit now? Look at him. Like, this is such a different looking Conor than like a year or two ago. Look at the fucking traps. He's got the little bit of water retention in his face. He looks way bigger. Yeah, I mean, look at that. His traps are popping out of his shirt now. Look at that. Got the gun show going on. Bro has turned it up a notch, definitely. All right, so this is from the video that I have coming out soon about pectus. I'm just going to let this run for a little bit and show you how I would approach things just a little bit differently than Conor.
Okay, so the starting point when dealing with pectus is always going to be 90-90 on the wall. You want to make sure to have something soft between your knees so you can get it.
And I want to start with 90-90 on the wall, because pectus people are usually so far gone that if they go to hook line, they probably aren't going to be able to get the posterior and lateral rib expansion they need. They're not going to be able to get their diaphragm to dome up as easily as if they start in this position. After you reestablish a little bit of the shape to your diaphragm and a little bit of like counter nutation and a little bit of posterior expansion, then we would move on to something like hook line.
So you can give it a little squeeze, like a 2 or 3 out of 10, not a ton of effort, but you do need a little bit. That'll help stabilize your pelvic inlet and outlet to give your diaphragm a little bit more solid base to dome off of. So we want to start here because this is going to be the easiest way to create posterior expansion. It gives you a nice reference with the back. And so what we're going to do first is you can think about doing a bilateral reach. So for this version, you're not really activating a lot of hamstrings. You're just getting just enough to turn on, just to feel the slightest little bit of posterior pelvic toe.
So chances are, if you're a pectus, like a compressed narrow, you're gonna have a lot of lower posterior compression. So you gotta be really gentle with this. You don't want to like get those muscles below your level of your trochanter to tighten up even more than they already are.
Not big at all. You need to make sure that comes through the heels. So you can start with a bilateral reach. You want to make sure that you're not reaching really hard. We don't want that sternum to cave in more. We're trying to kind of do like a very soft reach, almost like you're reaching around with like slightly supinated arms.
That's something else to keep in mind. If you have pectus, your joints are pointing laterally. Your glenoid fossa is going to be like very deviated laterally. So your straight out in front of you isn't going to be straight out in front of you. It's going to be like off to the side. So keep that in mind when you do your reaches. Also keep that in mind when you're doing your training. Like, don't necessarily force a row to come right by your side. Let it hang off a little bit.
Awesome. So you're gonna do your long, fully exhale breath. It's so important to get that full exhale so you can get the lower ribs to actually drop.
If you have pectus, you don't ever get a full exhale. If you don't ever get a full exhale, you've got no chance of reinflating that pump handle because you've got to create that zone of apposition so you can get the airflow to do what you need to do.
They don't drop. We're not going to be able to get that diaphragm to actually dome up, which is so important if you have pectus. So we start like this, and it's just like all the breathing stuff. If you're not familiar with it, you want to do about a 4-second at least exhale. And once those ribs drop at the end of the exhale, you should feel a tiny little bit of side abs. You're going to inhale and think about right now expanding everything kind of low, lateral, and posterior. So think about the lower part of your rib cage.
And so that would be the first thing I would do would be a 90-90, just to get some of that lower posterior rib cage to expand, just to restore a little bit of counter nutation. Then I would go to sideline to get even more kind of lateral expansion.
So after you've done the 90-90 breathing drill on the wall, the next step is going to be to go to sideline. Now, sideline breathing is really beneficial if you have pectus, especially after you do the posterior expansion drill that we just did, because it's going to help change your shape just by using gravity and the ground. Because when you're so squished.
Pectus people are going to be super flattened. Like a narrow ISA, normally they kind of squish like that. When you have pectus, you're squished like a wide. And so when you go to the ground, right, now we've got gravity, we've got compression from the other side to help close that ISA to give you a little bit of that volumization back to your rib cage.
Anterior to posteriorly, laying on your side, that's going to restore some of that volume of your rib cage in some of the normal shape that we want. So this is another drill that you can use the balloon on, but we're not going to. Just make sure that you have something for your head to rest on so you're not using your neck muscles. And again, if you have a little bit, if you lean into that left AIC pattern, you're going to anchor your left heel just a little bit more than your right. You will just pull, you can more think about pushing the heels into the wall, both of them, but just a little heavier on the left. And you can lay on either side. If you have like a really bad right VC pattern, you might want to start like this on your right side. That's just going to help the right posterior rib cage expand a little bit more, and the front side, just because all the viscera, everything's going down to the downside. That'll help create a little more of that shape. So on this one, we're going to, you got to make sure that your shoulder isn't out in front of you, and it's not like super retracted. It's got to be like stacked, and it's going to be a difficult position to achieve if you have pectus, because your body wants to collapse in. So you got to make sure that we're not turning in and letting the sternum drive inward even more. So what we're going to do over here is a left reach, and you can turn and look towards it.
That's also why I'm doing the reach laterally, is because sometimes if you do a reach forward, you just start to close down so subtly if you've got pectus. So that lateral reach will keep you open, it'll keep you able to get lateral expansion. So I used to kind of point straight ahead to try to get more posterior expansion, but now I just do the 90-90 first, and I go to this, and the focus is solely lateral pretty much.
Same style of breathing.
So I felt a lot better. The first breath I took, I was really not applying my heel pressure, and I was kind of like collapsing down. You gotta put a little pressure, so you have like a little, what we call like a hemi bridge. So you can't be totally down, laying heavy on that hip. You need to have that little bit of that lift there.
And these nuances are everything. Like, you can be doing everything right in your mind, but you could be missing just the little fine details and think that this is all bullshit. You're not going to get anything out of it, because it is so important to get the right contact points, to get the right positions. Otherwise, you're not going to elicit the change you want. So after 90-90 on the wall and sideline, the next thing I would do, my third move, would be maybe something like a hook line pullover. So again, you want to establish the other areas of expansion first, posterior ribs and lateral. Now we can start gaining a little bit of a pump handle lift. We can start working a little bit more alternation of the rib cage. So on this, we want to make sure that as the arm goes overhead, that scapula is really upwardly rotating. That medial border is staying on the rib cage. You don't want any kind of like winging at all. And you're going to really pair that with a good inhale. And as you bring the arm up on the exhale, we're going to drop the ribs a little bit. So don't do that. Keep yourself anchored through your heels. As we're doing this alternating reach, we're trying to restore alternating mechanics that'll kind of follow us in our gait pattern. And so in the video, I also kind of go over some ways you might want to do your strength training programming to make sure you don't make pectus worse. Kind of show you a couple things that I like to do for my clients, and then I'll give you guys an example of one of my clients who's got severe pectus, as you can see there, and some of the stuff that we've done as far as like in between the positional breathing drills and actual like full-blown workouts. So just a couple of examples of how we'd want to progress this. And again, that video will be out soon. Check that out if you have pectus or want to know how to treat it if you have clients that do. All right, so up next, we've got my friend Elle, the scientific snitch, who was just recently on the podcast, and she has hypermobility, which I have a couple clients that have that, and I help people out with that a lot. And it can be something that's really frustrating because they tend to have chronic inflammation, chronic pain. They produce too much collagen. They just got too much elasticity, and they're just really good at compensating in ways that are hard to manage. And so I see a lot of people critiquing Elle when she does her bench presses, which, you know, this isn't how I would bench press at all. Elle's great. She's got a good physique. But let's take a look at this. So I've heard her talk about she does it this way because of her hypermobility, and I understand that completely. Like, this is going to make you feel stable. It's going to give you something that you feel like you can actually move weight on, where otherwise you kind of just feel like you got no way to manage the pressure. But this isn't the way I would have a client of mine approach things if I was dealing with someone who wanted to fix their issues, if they were dealing with pain at all. Again, nothing wrong with this. If you would like to bench press like a powerlifter, I just had Angus on the podcast recently, Angus Bradley, and he talked about how he knows it's not necessarily like the best to bench like a powerlifter, but that's what he likes to do. He wants to put up big numbers doing that, and he presses other ways doing other things. But like, that's fine. Just understand that, you know, you are creating some potential compression issues that may be taking away movement variability, which is hard to tell when you're hypermobile because you've got so much laxicity and a lot of options in other areas. It's hard to tell when you're super compressed. So when I've worked with people that have Ehlers-Danlos, they've got a lot of shit going on. Like, they got weird digestion stuff. A lot of times they've got like vagus nerve issues. Their fight or flight is really turned on. They have like a little bit of down regulation of their parasympathetic nervous system. And often they don't connect to their muscles. They feel like everything else when they work out. So I'm going to show you some things that I would recommend to kind of help you manage your hypermobility if it is something that you're dealing with. Because if you've got pain, this probably isn't the way you want to set up your bench press. And in general, you want to avoid excessive range of motion, really big arches, like with all your training. So this is how I usually bench press, and this would be a fantastic move for Elle. It's essentially exactly the opposite, right? Like, this is very propulsive in nature. I mean, look at that crazy arch. I mean, the shoulder blades aren't going to be able to move. I mean, you guys know I don't love big arches for a number of reasons, but I mean, this is what we would call propulsive, and this is what we would call yielding. So I'm going to hook line, my back's flat. Now this is way heavier. I could put my feet down. I mean, if I got my feet down, I got an arch, I could rep out probably 330 like this instead of 275 like this is. But I'm trying to keep my back flat. I'm trying to keep my posterior rib cage expanded and managing the pressure gradients. I'm managing the dynamic, like full body coordination. I'm not trying to lock things down to where I can be completely stable because I've closed everything down and I've just got like a couple things moving. I want to manage all the way those little parts move together. I want to get a good compression expansion gradient, which you can't get if you are locked in a propulsive thorax. So if you have hypermobility, one thing you want to get your body good at is yielding. I showed you an example of how to do a yielding bench press, but you also want to teach yourself how to truly absorb force, because like you absorb it everywhere if you're hypermobility, or like in like one or two really like specific areas. They really don't have a lot of muscular yielding. It's all on kind of on passive tissues and joints. And so things like false throws could be really good. Here's my man, Dr. Pat, showing some examples. He's gonna be on the podcast next week. Really looking forward to that. So instead of actually throwing it, you're stopping yourself. And that is actually really, really beneficial if you have hypermobility. So instead of going into that full global extension, you're stopping once you're getting just a little bit of extension. There's another couple of examples from McKinnis Watson, who's got some cool plyo things. So you could do this without actually throwing it, and that would be a good example. I think he's got some others where he's not throwing it. So here we go. So this would be great. Something like this where you're doing deceleration. And then these are money as well. Like these would all be really good to do if you're trying to manage hypermobility. This is also somebody who could benefit from using the balloon on some of the positional breathing drills. And you heard me mention this propulsive spine position, this propulsive extension. Like we want to train her spine to learn how to go into an extension, but in a yielding manner. And so one thing that could be really good would be like the pullover that I did for pectus. So if you do this right, your spine moves into extension. You can see, but it's slow, it's kind of segmentally, it's in a yielding style. So you can have propulsive extension and propulsive flexion of your spine, but you can also have yielding extension and yielding flexion, which are really, really important to be able to do. So inhalation is just another example of a yielding extension. As you inhale, your spine extends kind of segmentally. An example of a propulsive flexion could just be like a rounded back deadlift, or say you were doing a medicine ball and actually throwing it into the ground like hard. And then a yielding flexion example would be something like a really light segmented Jefferson curl, something like that. I also really like sleds. If you are this kind of hypermobility person, just doing like just a normal sled push where you're holding with your arms, that forces you to kind of create the kind of compression that can help that pressure management. That's a really good move, just kind of loading up a sled push. So just keep in mind, if you're hypermobile, like try not to get your stability through locking everything down and keeping everything moving. True stability is going to come from managing the dynamic pressure and shape changes, not just locking down into one position. All right, so let's take a look at Eric Janicki training some chest. Now, neither Regan nor Eric have good chests. They both got crazy good backs, and you can kind of see why. Like when I'm watching Regan do these flies, there's no posterior expansion at all. So he's not able to get true length and tension. He's not able to get a full shortening contraction either. As he's going back, the scaps just immediately compress. There's no kind of like intrathoracic pressure to keep tension on the front. If you just immediately retract like all loosey-goosey, you lose tension on the front. And I don't know what this exercise is, but it's stupid. I would not be doing this at all. And I don't hate everything Eric does. I think he does some good stuff, as you'll see a little bit later. But I can definitely see why he doesn't have the best quads and why he doesn't have the best chest. And so let's look at him do his super huge range of motion leg presses. So he's got the knee wraps on. We've got the pelvis moving under. That is just getting squished. We see that belly pooch. Anytime you see that, you're reinforcing it. You don't want to fucking see your gut popping out like that. Maybe if you're a power lifter. So that was a little too big a range of motion. His pelvis is rolling under. Here he's really looking down like crazy. And like he's not getting a huge external rotation, but you can just tell he's letting that pelvis run under pretty quickly. And personally, like I'm actually not the biggest fan of using these kind of shoes, or even necessarily always using wedges like for heavy loads. Like I tend to use that more for mobility and like warm-ups. But the problem with those shoes is it kind of locks your foot into like an early propulsion position. So you got a stacked heel like that, that's going to kind of put you in that position right there. So you've got a little bit of a posterior translation of that tibia and a little bit more dome to your foot, and it's kind of like stuck like that. I really like, minimal shoes. I'm not saying that everyone has to use them. You have to be able to feel your contact points of your feet. So sometimes it's not minimal shoes that are the best for that. But I don't like these because I'm not able to connect to the actual change of the shape that I want to happen on my foot. So as I'm going through this leg press, and you guys check out my quad video if you haven't seen that, because I talk about this in detail. I want to have my foot be able to go into pronation as I'm going deeper into that squat. And a lot of times with those shoes, you're just stuck in that kind of early representation. You're not able to really get the foot to go into a mid-propulsive phase, which is what we want when we're doing our quads. We want to be able to feel that pressure drive a little bit more in the inner part and the foot flatten a little bit as the tibia starts to translate further forward over. So as we're going through our leg press or any squat pattern, we want our foot to flatten out and go through relative motion through pronation as we're getting deeper into that hip flexion. If you've got those shoes on, a lot of times it's hard to get your foot to take that shape. So I don't know. I mean, I suppose they could be okay for somebody if you're stuck in super late propulsion, you got super flat feet maybe, but I don't know. In general, I'm just not a fan of them. I don't think they let your feet change shape as easily as they need to direct IR to your quads. And on the leg extensions, no counter force really. He's kind of letting them come up. Yeah, I mean, he's sitting back down. This is stupid. This setup is stupid, dude. It's taking away tension. It's taking away your ability to produce counter force by pushing your hamstrings down into the pad. You want to pair knee extension with a hip extension. I cover this in my my favorite cues, my ECM bodybuilding cues. If you haven't seen that video, definitely check it out. So if we look at him, I don't know the time between these pictures, but he obviously got huge. But look what really didn't change. Like everything else got big, but his pecs aren't like that crazy different or that impressive. And while his adductors grew like crazy, he still ain't got no quad sweep. And that's because he's not producing internal rotation. He's sacrificing that to get depth. So let's look at some back training now. I am a lot more on board with the way he trains his back. And it kind of makes sense too if you're a really wide ISA and you're trying to do this huge range of motion. You don't really compress to the front as bad, but we get really bad posterior compression. So trying to do a huge range of motion for things where we need to maintain posterior expansion makes sense why that might not be that good. But if we were to do things that require a really big range of motion and wouldn't be good with a lot of anterior compression, well, that's not too big of an issue. You can really stretch hard and you're not going to close down and do stupid shit like a narrow might. So I can see why someone like him and Regan have crazy good backs, but they've got terrible pecs because they've got a lot of posterior compression, not as much anterior. I'm pretty on board with most of his back. Well, that's too much. Now we're a little dumb, but yeah, I'm pretty on board with most of his back stuff. Like this is not too far off. I just don't like the quad and I don't like the pec stuff. And I mean, I definitely don't like this, but whatever. I mean, I just think it's a little silly. I don't think it's like terrible the way he's doing it, at least. Definitely, even though he's doing the same kind of ridiculous shit of Dr. Mike, you can just tell he has got way more tension and actual connection to the muscles doing this type of shit. Good back, for sure. I'm not against doing these. I don't hate sissy squats on this, but I would probably try to stay a little more extended in the hips, make this a little bit lighter, and just keep those hips up more. But the same reason why he doesn't have a chest is why he doesn't have quads. I don't see a lot of posterior expansion in the pelvis. Same way I don't see a lot of posterior expansion in the thorax. So yeah, just not the best pecs. Great physique other than that, I mean, and the legs. But again, you don't need that big of a range of motion. That is, nothing good's coming from there. And I know he's really attached to this way of lifting, but I promise he would get better results than, like, I don't know if he's getting pain at all. I don't think he's getting pain. Like, he does this big range of motion, like, okay. He's putting a lot of stuff on his, like, connective tissue and his axial skeleton. Like, he's doing it in a way where he's not going to probably fuck himself up too bad, but he's just not doing it in a way where he's going to really get benefits as far as, like, actual stretch tension. Okay, this one looks a little better. This one doesn't look so crazy, but, oh, yeah, now we're getting a little bit nuts with that huge range. And I would control the breathing. Like, I would, like, make sure you're exhaling when you're doing work. Don't let your head come so far forward. I also think if you were, like, a narrow and you're trying to lift like this, you're going to get fucked up compared to a wide. Like, a wide can get away with a lot of this. A narrow, you compress so much more subtly and more, like, extreme in the sense that you have turns that occur. You get a little more asymmetrical. I definitely don't recommend this kind of lifting style if you're a narrow ISA. I don't recommend it for anybody. But so, yeah, overall, not a fan of any of the pec moves I've seen. But Eric seems like a really nice guy, actually, and I like this stuff. He seems to, like, be trying to, you know, put something positive out there in the industry when all of his buddies are just fucking shitheads. So somebody sent me this, and it is TNF talking about breathing. Let's check it out.
Everybody who says breathe while lifting has never lifted heavy.
And this is just a take that is just so wild and kind of problematic for me since so much of my shit is breathing. I spend probably, like, God, how much do I spend? Say I spend like 15 minutes out of every session that I run. So I'm spending, I don't know, at least least an hour and a half per day just coaching breathing. So yeah, it matters while you're lifting. I get it if you're doing a 1 rep max, you probably won't think about it. That's not the hugest deal. But when we're like working out, like we're doing bodybuilding rep ranges, you want to make sure your breathing pattern is gonna be something that's going to facilitate what you're trying to accomplish, because how you breathe can have a big influence on the expansion to compression gradient. So I'm just going to break down some basic breathing strategies. So in general, if you're not super compressed and you're just doing work, you're a bodybuilder, you want to usually exhale while you're doing the work, while you're doing the concentric portion, and inhale on the eccentric. Pretty basic. You want to make sure that you get a pretty decent exhale, and you want to inhale through your nose. A slightly forceful exhale will help you drive internal rotation through the whole system. Now, there's a lot of ways to play with breath to manipulate things. You can actually use breath to manipulate your shape. So, for example, something that I have had some people do is when we're doing squats, I'll have them pre-inhale. So, for example, I had a client who I was trying to bias her quads on some squats, and she was just really popping into like a pretty big anterior tilt and lumbar extension like right away when we were dropping down. Her pelvis was a little bit like tipped forward and a little bit nutated relative to what's like natural for her as a narrow ISA. So you can think of her pelvis as kind of looking like this. You can see that sacrum's tipped forward. As you squat, you're gonna kind of put your butt out and use a little bit of your back if you're starting in that position. So what we did is I had her take a deep inhale before we started and then go down with an inhaled breath and exhale on the way up. And she felt tons of quads and was totally upright, and she didn't know what happened. But what we did is we changed the shape of her pelvis from this to taking an inhale, and we've promoted counter nutation. We've got the ilium to move out a little bit. And now we've got a lot more vertical spine than where we started. So we're able to have a lot more room for internal rotation from the femurs now. And we're able to stay a lot more upright. We're able to keep a lot more tension on the quads. So just by taking a really good inhale before we did the lift, we were able to reposition our pelvis in a way that allowed us to keep tension on the target area. Another way that I use the pre-inhales is when we're working, say like shoulder flies or even just like rows. So a lot of times, if we are trying to do a shoulder fly and we're getting to close to like 90-ish degrees and we don't have a convex surface of this posterior rib cage, our scapula is not going to really be able to upwardly rotate with us to keep tension on those delts. That's when we kind of jam up and start getting a little trappy. So what you can do if you are someone who's posteriorly compressed, and I do this all the time with my clients, is you can get a pre-inhale, expand that posterior rib cage. So you inhale, lift with the inhaled breath, exhale as you come down, kind of reinforce that shape. You can actually get a better range of motion and better tension just by creating a little bit better surface for that scapula to glide off of. Now it can actually upwardly rotate. I do the same thing with rows. I had a guy today, shout out to James, out from Boston. When he was rowing, he was doing his on the bench dumbbell rows. It was just like really overly compressed. And so I had him drop one dumbbell, do a reach, do a pre-inhale, and then now that scapula is not jumping around. It's actually getting like a smooth glide across that rib cage. I mean, you can use breath in all kinds of ways. You can exhale like forcefully on a press, and that's going to help close your ISA. That's going to help with protraction. It's going to help keep your traps from getting involved if you get a good exhale. And you want to like know how you should breathe for your setup. Like if I'm a wider ISA, so I'm a little bit flared out here, what I want to think about is I actually want to inhale through the upper kind of middle back. I want to focus on getting inhales through there. If I'm a narrow ISA and close like this, I want to think about getting breaths through the lower part, the lateral lower part. I want to get those to open a little bit. Where on the wide, I'm trying to get the posterior ribcage to open. You want to use different breathing styles depending on if you are a narrow or wide ISA, especially for the positional breathing drills, but even during the workout, it's something to think about. For the narrows, you want to open your mouth and kind of get a bigger diameter for the airflow to come out. We're trying to change the physics of what's going on internally. For a wide, we want to do the opposite. You want to do a little bit more like pursed lips, a little bit more forceful exhale, because again, we're walking around flared ribs, we get a forceful exhale, we drop those, now we can get posterior expansion. If you're narrow, you're already closed down, you get a forceful exhale, it's going to close you down more. So you want to little bit softer exhale. If I'm doing alternating, say I'm doing like a reciprocal curl or a reciprocal motion, I want to keep my left side exhaled and I want to make my right side more inhaled. So I'm matching my breathing up with that. So there's a lot of ways to incorporate your breathing. I wouldn't say ignore it. You don't have to get obsessive about it, but I definitely don't like TNF's take on this. And I used to say I don't think TNF had any bad takes. I think he's got quite a few takes I don't agree with now that after watching it, but I still think he puts out great stuff and is a really good source for like beginners to go to. I think he's probably the best out of this kind of science-based crew. I think he's science-based. But yeah, you gotta breathe, bro. All right, so up next we've got my buddy Ben Yanez, who I seem to feature every week, but I just think people can get a lot out of kind of seeing the different perspectives that we offer. So let's check it out. So here we have Athlete X. Is he still around? Talking about how the pull down is his favorite move to do for biceps. And Ben is saying how in order to do it for biceps, you need to do this. It's not a good bicep move at all. Which, from an ECM perspective, this is actually a really, really great move. It's not the only move you'd want to do because you don't get a full yielding or eccentric lengthening cycle, but this is really, really compressive and can be really good at building some tissue. So if we think about why the old school guys liked it, they didn't really have all this dead guy anatomy stuff in their brains. This stuff wasn't around as much. And so like what they're thinking about is the in position and like the load. Like they're supinated, they're close grip, they're down here. So you feel that. I mean, you can just feel your biceps a lot. And old school guys were all about mind-muscle connection. And then we've got the dead guy anatomy, science-based crew now. And, you know, if we're pulling from here and that amount of shoulder flexion, that's not a good line of pull. You're not getting length and tension, so it's not a good bicep exercise. But from an ECM perspective, it's a little bit more nuanced. It's actually a super good compressive move. It can definitely build some tissue. We would just want to make sure to pair that exercise with a more yielding, more lengthened move as well. So instead of just thinking of like a line of pull from an ECM lens, we're kind of thinking like what tissues express force in that position. So when you're close grip, supinated, that is a very compressive strategy. Your sternum's put forward, your upper thorax is compressed, your humerus is relatively IR'd and adducted. This creates a really compressed concentric orientation of that anterior kind of lower part of your arms. You're going to get a huge pump in your biceps. So compressed tissues hypertrophy well. I think that people have gone off a little bit on how important negatives are for building muscle. And so on this, you can just think of that as like a good concentric, really big concentric contraction. And a lot of the lever model guys like Ben will just kind of dismiss this as a good bicep exercise because they're only looking at torque production capacity, not the adaptation to sustained compressive forces. So it's not the best move for biceps. If you're only going to do one move, I would probably just pick like a standing curl, something that's going to take you through a little bit more eccentric lengthening as well as that compression. But if you were to pair this with like an incline curl, that's fucking money. That is a great bicep workout. There are going to be very few bicep exercises that put you in just a highly compressive position, and that's how you build thick, peaky biceps. And I don't really got those. Maybe I should do more close grip chins. So this is just another example of why, like, I think that we don't need to write off the what the old guys felt as far as their mind-muscle connection, because a lot of times the thing they felt makes sense through an ECM lens. All right, and we're gonna check out Ben talk about how to do some rope crunches. And so most people do their crunches like this. I will agree with that, and that is shit. So he's gonna show you how to do it a little bit better. So keep your pelvis anchored and just kind of flex at the spine. So that's great. That is, you know, not a bad recommendation. That's going to get your rectus a lot better than the way you were doing before. And there's nothing wrong with this movement at all. But I have a little bit of a different setup that I prefer to use to get a little bit of the deeper muscles and to get a little bit of that stretch tension that all you nerds love so much. You know, so many times when people are working their abs, they're not actually getting any kind of a stretch. I mean, think about it. What movements are we getting a stretch in your abs? Like, really? If you do that move that Ben was just doing, there's no stretch. It's just compressive stuff, which can be fine. But again, just like the biceps example, we want to pair that with something that's going to be a little bit more yielding, a little bit more eccentric. If you do like decline crunches, you're still going to like a flat back. You're not hitting true length and tension. If you're doing hanging ab raises, you're still starting at like neutral, lifting up. There's really not very many moves at all that put you under length and tension. That is why I absolutely love this move. So this is a clip from my members section. I post my workouts over there weekly, and I really dive deep into the nuances of the positional breathing drills, my thought process behind exercise selection, and I break this stuff down in detail. So if you are interested to see how I actually do my own workouts, check that out. So you want to make sure that you can do this where you have your feet flat on something behind you. It makes a big difference if you get those foot contacts. That'll really keep your pelvis in a better spot to really get equal activation. A lot of times it's easy to get more of like your right side if we're dominant there, and also it's going to help us facilitate some of the deeper stuff if we can get those foot contacts. So it's also just going to stabilize your pelvis to give your abs a little bit better surface to like contract on.
Really important to get a really good inhale on the way up on this.
And
TNF, breathing matters.
if you're stiff in your back, this would be a great move for you, but you want to like work up to it. Because you can go into this extension, and if you overdo it and you're not used to loading extension, especially in this kind of weird position, you could get a little tweak. So start like, that's happened to me in the past when I used to live in a lot more extension than I do now. I haven't had any issues in a long time, but back in the day, I definitely did once or twice.
And so, guys, this is why I preach this shit. I do the EC model stuff because I have a better physique than I've ever had, and I have no pain. I don't feel my joints at all. I'm 38 years old, and when I was 28, I felt shit. I never was, like, really fucked up, but I felt my neck, I felt my back sometimes, felt my joints sometimes. When you understand how to directly apply tension to the muscles, you save your joints, and you kind of give yourself a longer career as a bodybuilder.
So you're not trying to get a huge crunch, a huge round, because we're not trying to get all that outer layer of abs. We want the deeper stuff.
So the way Ben was doing it was really good for your rectus abdominals, but I'm trying to hit transverse abs and like deeper stuff. So it's going to be more functional, but it's also going to help to, you know, create good aesthetics too, because you want to be able to like get that lineal deep. You want to be able to draw on that waist.
All right, so I'm going to show you kind of what the difference is, what it looks like when you're using deeper ab muscles versus the outer ab muscles. So this is the outer rectus, if you're just really round.
And you can see I kind of got a little bit of a belly pooch there.
And you see like a pooch at the bottom of your abs.
A ripped as fuck pooch.
That's going to be more rectus abdominals. If I can pull in and taper, create a deeper like line essentially, instead of just rounding, I'm basically making that leaning out, but like as deep as I can get, and I'm pulling the waist in there versus there.
So I was trying to show you the difference between the rectus abs and the deeper abs there. Here's a set of just what it looks like when you're just doing a straight set. And so you want to have your heel reference on there. Make sure you've got your heels down. So you might have to lean forward on a little bit, depending on how high you have the cable. You might not be totally vertical. I don't have a side angle of this, but I'd be leaning a little bit forward. And this is money. I mean, I do this, and I do hanging ab raises, and really that's it. I might pike a little bit, but I think this is a really underrated move, and I guess it's kind of a bitch to set up, but if you can do it, definitely my favorite ab move out there. All right, so that is it. I think that is all I got for you today. Nothing super ridiculous this time. We'll get a little crazy on the next one. We'll do some mug shotties. I had to let them build up a little bit. I think I reviewed most of the recent ones. So I just want to say thank you guys. I finally hit 15K, and I'm at over 200K watch hours. So thanks a lot for the support. As I said earlier, check out my membership site. You can look at my schedule in the description below if you want to book any consultations. I'm kind of running out of availability, but there's a few times left in there. And I just want to say thank you guys, like for real. Thank you for your support. I'm not going to be like Paul Carter ever and be a fucking dickhead to my supporters. If you have any questions, comments, or suggestions, drop them below. Peace.